right, so I will call the meeting to order. Do roll call.
Linda Hope.
Present.
Lindsay Keisman. John Ryder.
Here.
Here.
Carolyn Schofield.
Here.
Amy Rath.
Here. All right, do I need to have a motion for them to participate, or?
You can. I mean, they're not voting, but it can't hurt. Yeah.
Okay. Could I have a motion to allow Carolyn and Lindsay to participate by phone?
I make a motion that Lindsay Keisman and Carol Schofield be able to participate per phone.
I'll second that.
Okay, just all in favor?
Aye.
Aye. Okay.
Aye.
Aye, great. Is there any public comment? All right, I do not see any public comment. Could I have a motion to approve the minutes of April 29th?
Make a motion to approve the minutes of April 29th.
I will second that.
Okay, any discussion? All right, all in favor?
Aye.
All right. Agenda items for discussion. I need a motion for this, right?
No.
Okay. So 4A, the FY25 Outcome Summary Report. Oh, I need to turn you on, sorry. Hold on. There you go.
Hello. So we'll be starting on page 4 of the agenda package, reviewing the fiscal 25 second quarter outcome summary, starting with the levy-funded fee-for-service grant and POP outcomes. Starting with domain 2, abstinence reduction in use, it was above network target. Again, we see some large differences between the network target percentage for improvement and the improvement reported. Specifically, domain 1 is still below network target, but increased slightly from last quarter. Domain 3 also increased from last quarter. Domain 5 decreased quite a bit, and domain 7 decreased minorly. Domain 8, which is access and capacity, this shows us how many new and total consumers were served in quarter 2 under this funding pool. Any questions on this page so far? Okay, moving on to page 5. Regarding client experience surveys, they continue to be above network target, even increasing in number sought and received. This quarter, we added a new question regarding the primary barrier in reducing the program's wait list during the reporting period, with responses of not enough space, not enough staff, not enough funding for fee-for-service programming, or other. Out of the agencies that answered, 2 stated that they have a wait list due to not enough funding for fee-for-service programming. 3 stated that it was due to not enough space, same agency for 2 separate programs. And 2 stated that it was due to not enough staff. 1 agency answered other, and this is due to the type of program that it is, which is housing, and with the extended length of stay and low turnover among residents, it limits availability. Overall, we saw a decrease in the numbers of those on wait lists and the average of length of time from first contact to initial assessment intake from quarter 1. For ineligible referrals, a large contributor is a provider that assists with shelter and housing. If we see high numbers in this category, we often encourage a presentation at our intake coordinators meeting as a reminder to those meeting participants. Any questions?
Make a comment. Thank you for bringing in the wait list information. I know that was a question from last time, so thank you for that additional research and bringing that in. Does anyone have any questions? No. On the phone, any questions? Okay. All right, then I believe we are ready to move on to 4B, the FY25 audits conducted through June 25th.
I still have a little bit more.
Oh, I'm so sorry.
That's okay.
No, we're moving on. No, sorry.
So additional report on page 6, we have increases in trainings, the A Way Out and C2R participants through New Directions, and naloxone distribution through Live for Lolly and NAMI Mental Health in the Workplace. Decreases in QPR trainings through NAMI, NAMI Ending the Silence, mental health board trainings, and mental health first aid trainings through NAMI, which had a very slight decrease. Regarding McHenry County overdose deaths, the number slightly decreased from last quarter. However, the number of suicide deaths unfortunately slightly increased from last quarter. Any questions with those? So moving on to page 7, the opioid settlement funded programs. Domain 1 is still well above network target at 100%. Domain 2 is also well above network target. So they are doing well with those. Any questions regarding those?
No?
On page 8, the access grant outcomes, we are just above average prescriber capacity target number this quarter. We were under the target number last quarter. We are also still above the average network target for utilized hours. However, it's increased since last quarter and much closer to the target. So it's good to see that the wait time is still below the maximum target days, or sorry, the maximum target of 19 days. New clients served increased slightly this quarter. Average cost of per client and hour service decreased from last quarter. Productivity decreased a bit from last quarter, and the average level of functioning is still above network target, even increased in percentage from last quarter. Client-reported hospitalization is much lower than last quarter and even below network target. Client-reported crises services increased a bit, but still under network target. Client experience surveys decreased from last quarter and was under network target. And a slight increase in ineligible referrals were reported from this quarter from last quarter. So any questions with the access grant outcomes?
No?
Can I ask a question? Sorry, it's Carolyn.
Yes, go ahead.
Okay, thanks. So the ones that are below target, just in general too, I know there's what you were just talking about, but I think there are a few others. Do we have any sort of like summary of recommendations, or does that come at the end of the year? Or I'm still kind of getting used to this process, so I apologize. But like, you know, I understand their targets, and I know we have new ones, and the newer ones seem to kind of be significantly under at times. So what's the process from there to try to then get them up to target?
So to make sure I'm repeating the question, so when there are targets where we're under and we're not being met, the question is, what's the process in order to make sure that we're closing those gaps, right?
Correct. Especially with the new ones, because I think those had bigger gaps, you know, I think on some of the other ones, but yes.
Sure. Yes, absolutely. Is that information that, Kayla, you can speak to? Do you need to follow up? I'm sure that for the different targets, there might be some different plans that go into place, but can you give a general overview?
Usually it will be during a consultation, during an audit.
Okay, so and again, I'm repeating to make sure everyone can hear. So during the audit, those gaps would be addressed and then specific plans put into place?
Yes.
Yep. Carolyn, do you want offline some more details on anything in particular?
I guess I was looking like how we can then use the information. You know, like obviously some of the areas, you know, how do we fill those gaps, I guess, like moving forward and kind of like heading into allocations and
Right.
knowing what's being met, not being met, or where we need to provide more. Like, how is our path to utilize that information to then understand what gaps we need to fill?
Absolutely. No, great question. Linda, did you want to speak on that?
I had a question.
Can you put your mic on? Sorry to me. Oh, you did. I'm so sorry. It's my fault. No.
I was wondering if you could address, Kayla, any of the things that they have talked about. So, for example, retention of knowledge was an issue. Have they talked about the providers about providing handouts or how they're reinforcing the information to make knowledge retention or specific issues be closer to goal.
We're having 1 second. We're getting a mic on.
Hi, sorry, this is Vicki Johansson, Contract Management Specialist, and I do a lot with the outcomes. Some of the bigger gaps that you're seeing with the low improved are compensated with because we now ask maintained. Because there are so many situations and so many areas where maintenance is a goal. You know, it's not just improvement. So where we've seen more of a decrease in the improvement, we've seen an increase in the maintaining. So I think some of the programs are still adjusting to that. You know, it's relatively new. For 26 on the application, we've asked them to provide their projection for both improving and maintaining. So that will help us to adjust ours because our target is only for improved currently, where next year, because we'll have a couple years worth of data, we should be able to then adjust our improved and then also include a maintained so that it's a better view of what's really happening.
It's a more holistic story. So taking some of the, to again, repeat and reiterate. So some of the, if it looks like there's a lower percentage of improved, some of that could be that there's a higher percentage of maintained. So folks who had previously improved are now maintaining their improvement. And then there is a feedback loop where what we are getting, to Carolyn's point, is going to influence and be a part of the funding cycle so that there is insight into where there are gaps, what's being done to remediate, and so on. And then, Bridget, I'm not trying to call you out, did you want to speak to that part at all?
I was going
or-
to state that, is
Okay.
that, you know, those types of, that type of data and that type of information from audits is taken into play when we do we consider funding. So that's part of the staff recommendations. They look at that. I think, but to Carolyn's point, I think she's looking for a bigger picture of where the gaps are with that data. I mean, I'm thinking we can pull that.
Oh, absolutely.
Yeah, so we can have that data, and I think what she was saying this, because she said this before in another meeting, was that she'd like to have something higher level during funding season to see where those gaps are according to this data.
Absolutely.
And if that's what you're saying, Carolyn.
Did all that come through?
Yeah, it is.
Okay.
Thank you. Yeah, well, sort of, and I'm trying to understand, but yeah, that's exactly. I mean, we get all of this good information, and I think, you know, sometimes we use it individually, but we also need to use it as a whole. And I just feel like we're kind of then not pushed to be able to utilize it. We're more just focusing it on individual, but I think we need to look at it as a whole as well.
That's
Does
a
that
good.
make sense?
Yeah, no, that's a good point. Take the high level view and then also be able to get into the details. That's a really good point.
Yeah.
Linda, okay.
Yes. So I just want clarification because I don't understand this. The goals that are set, those are set from prior achievements or national?
It's a 3-year average
Okay.
of what the network reported.
So it is not unrealistic or too high. It is something that can be achieved and was in the past so that we should be able to meet it.
So in the past, we only asked the providers to give us the number of, or the percentages of improvement, just straight out improvement. So they were lumping their improved and maintained all into approved. We're now asking the providers to separate those two. However, our target is still only improved.
Okay. Another, because I'm sort of just looking at the target right now, and I wondered if we have any comparison to like national targets?
Up until this past year, We did use the national outcome measurements from SAMHSA, I believe, and took that into consideration. We can certainly pull those if you'd like to see how we compare locally compared to national. We just found that since we have had years now of our local averages with enough data to make a prediction for our, or a projection for our providers, that we didn't need to include the network or the national outcomes percentages in our calculation. But we can certainly provide them if you'd like them.
I think it would be good to look at, just because I know some things are difficult to treat and tend to have recidivism. And so, not to point fingers, but to say, are we setting a goal that's achievable? And if we were achieving it before and we can't now, like, not so much scolding is like, what has changed?
Right.
Like, let's look for what's changed in the process. But if they're doing that, that's great. But it'd be nice to sort of have a better feel for where we're at.
Absolutely. Can do.
Great. Any other questions or discussion on 4A? All right. Sorry about trying to move us on. So the audits conducted for 4B, audits conducted through June 25th, 2025.
Since March 13th, we have conducted 18 audits. Within those audits, we found issues with ROI, such as lapses between dates, expired releases, and some not filled out properly. We also found some issues regarding lack of outcome measures and files. We had findings with assessments and treatment plans, such as lapses in dates, missing signatures, and signed after treatment plan, or that were signed after the treatment has been started. We had 2 audits that required recoupment. Neither of these were major findings and have been handled. However, all of the agencies that were audited had all background checks completed, physician licenses were verified, and the service navigation checklist training was completed. We have 1 audit report from June that is still pending due to a finding during the audit that will be further reported on at the next Ethics and Compliance Committee meeting. We have done 3 audits in July and are planning on 3 more in August. Our prior compliance operations manager left us in such a good shape that we have been able to keep doing audits as usual with no interruptions and have been getting audit reports out in a timely manner. Any questions?
Great. So to recap, sorry, I don't know what's going on with my voice. So to recap that, it sounds like you've been very busy, that you were set up. You've done 18 audits since March as of the June report, 3 in July, 3 more scheduled for August, and that we are on track going into funding season with having the audits completed. And there have been no major findings. And then you gave a summary of some of the
Yes.
items. Okay. Any questions or discussions on audits? All right. Then I believe we can move on to old business. And we don't have any. So I will move on to new business. And we don't have any there. Any member comment? All right.
Amy, this is Lindsay. I'd like
Yes.
to make a comment if
Go.
possible.
Of course, go ahead.
Yeah, I just kind of wanted to go back to, the email that Kayla sent out, and she mentioned the wait lists earlier and the more detailed explanation for the wait lists. And, as I'm looking at that in front of me, and we're talking about how do we use information during allocation process. And when I look at a few of these, I realize that some of it still leaves me with follow-up questions. So as an example, not enough staff from, AID and thresholds. So the question for me with that is why, right? Is it that their compensation isn't high enough? And that has something to do with, purchase of position salaries that, they might request from us. you know, when I see something like not enough space and Clearbrook is listed there, it's like, okay, that means, you know, potentially like a Scylla, right? So some of these things, you know, feel like they make really good sense to me, and some of them, I'd almost like want to know what the conversation looks like when that comes in. The not enough staff is one for me. But when I look at not enough funding for fee-for-service programming from Family Health Partnership and Pioneer Center, those to me seem like a clear indication for, okay, how do we prioritize giving them what they need then, if we can. Whereas some of these, I want to make sure that if we are giving more dollars, for instance, not enough staff, you know, what is the reasoning for not enough staff? And is it something the mental health board, through funding, can even do something about? So those are just my comments. I'm thinking out loud, and wanted to say that, I guess, maybe for Kayla and Bridget, you know, as you're talking to people, or even in, you know, network council, or even private conversations with the people and places that reported that, I'd love to have that context, because I think it could really influence decision-making for allocations.
I think that's a great.
it.
No, sorry, I didn't mean to interrupt. Thank you, Lindsay. I think that's a great comment. So it's understanding, which would be helpful specifically through the board lens, not just why there's the wait list. Is this something we could potentially solve? And I'm sure, you know, there are other interests where if somebody else could solve it, what might that look like? Yeah, I think that's a really interesting conversation, because that would definitely aid me as well in looking at funding, knowing that somebody has, you know, this need to back it up, where we could move some bodies off the wait list if XYZ happened. Thank you for that. Any questions, Bridget or Kayla or anyone on Lindsay? Okay. All right, then if there are no further comments, take a motion to adjourn.
Make a motion to adjourn the meeting.
Second that.
All right, all in favor?